You know, it's very, very encouraging how successful cancer treatment is these days, how far we've come in that area, and we've really come a long way from saying it in a hushed whisper, and even before that, putting people up in the basement and just letting them rot, to now where we can openly discuss it and actually discuss treatments and also prevention and our options. So this is where this next expert comes into play, because when we are told something is happening to us or to our loved ones, our heads begin to swirl, we get very, very frightened, and we can't think. We kind of shut down, we become infantile, and we just instantly, like in a second, turn your doctor into a god, and whatever he says is like, oh, okay, whatever. I just want to live. But we as an organization at Cancer Schmancer want to offer you some of the other options. I always say to people, you know, they'll say, well, this is what's being recommended by my doctor. And I said, that's great. But knowledge is power. And it's always good to make an informed decision. So it's important that you understand alternative options. And then you can begin to think about what resonates with you. What philosophy seems to make sense to you, and whether or not I want to follow my Western doctor, but complement it with the alternative, because there's no downside to that either. One works at trying to eliminate the cancer by destroying it. The other works from the angle of trying to bolster your immune system so your body can do its job more effectively. So there's a marriage between the two that's like the hybrid of the way we should start thinking about medicine and cancer treatment as well. Because remember, when the doctor calls and tells you you have cancer, at the end of the day, he goes home and eats dinner with his family. You go home and eat your heart out with yours. So it's your life. Don't give anyone power of attorney over it. Do the research, figure it out. Don't be pushed through a cattle herd as if that's the only option or that's what's right for you. This is a very critical time. And when you least want to deal with it is when you have to deal with it. Roll up your sleeves, gather together a posse of thinking friends and family who's not going to make it about them and how upset they are that this is happening to you, but people that are going to make it completely about you, help you. So now I would like to introduce you to an alternative doctor who has his own hospital called Hope for Cancer that is in Tijuana, Mexico. He has a whole different view of how to deal with cancer, and I find his point of view very smart and cutting edge and interesting and mind-expanding, and it's good that we see other options as well. So please give a warm welcome to Dr. Antonio Jimenez. Dr. Tony, thank you.
Thank you. Thank you.
Thanks for being here.
Good morning. Hello, everyone. Thank you, Fran. Thank you, everyone involved with the Health Summit to put this together. And mostly thank all of you here for taking that rush hour traffic in the morning, right? We came from San Diego. So today I will share powerful, life-changing information because the lifestyle choices that we make have a significant impact in the healing and prevention of cancer. To put it in a simple phrase, we treat the patient with cancer. We don't treat the cancer in a patient. That makes sense? So this is the topic today, the present and future of non-toxic cancer reversing therapies. And how does this all start? On the left, you see my father, my mom, and myself. My dad, years ago, was diagnosed with stage 4 prostate cancer, and he was in Houston, Texas. Everyone in Houston goes to MD Anderson, who has cancer, and fortunately, I was able to intervene, and my dad died at 82 years of age, 20 plus years later from natural causes. So that was one of my wake-up moments. And then in the middle, you see Whitney with her mother, Marcy. 16 years ago, Marcy brought her daughter, who at the time was 5 years of age, to Hope for Cancer in Tijuana, Mexico, with the diagnosis of leukemia. And I would be happy to say you see Whitney on the right. Whitney is married. I walked her down the aisle last June of 2015, and she will give us our second grandchild. And if it wasn't for Marcy, my wife here, if you could stand up, honey, I wouldn't be where I am now. And it's all about patience, right? What we work, the previous speaker, wonderful job. It's all about you. It's all about you. How many people here have or know someone with cancer? Yes. Probably 40%. So these are just successful cases. We all have successful cases. I want to say cancer is not a death sentence. Fran said that the word terminal. When a doctor tells you you're terminal, please ask him or her, are you not terminal? Right? We are all terminal. So we have a patient locally in the center here with stage 4 pancreatic cancer. She had the Whipple procedure at Cedars-Sinai. They told her everything was clear. Whipple is the most aggressive cancer surgery that there is, as you know. And 3-4 months later, she had pain in the surgical site. They didn't want to rescan her because they said, we told you everything is clear, come back in a year. She kept on insisting, and sure enough, they found recurrence to the surgical bed and also to now metastasis to the liver and a few suspicious spots in the lungs. So Revi, I'm not sure if Revi is here, and her daughter Tova, they're from here locally, but she's almost at 3 years and cancer-free with stage 4 pancreatic cancer. If you forget anything that you learned today, please don't forget this slide. And we were blessed to have the 7 key principles to cancer therapies published in a peer-reviewed journal out of UCLA. And that's kind of interesting, right? Because it's an alternative approach. And these 7 key principles apply to all of us in the room. So if you're looking as to what to do for your diagnosis of cancer or for a friend, in my 25 years of working in cancer therapy, I put together these 7 key principles, and we have to address each and every one of these 7 principles. Number 1 is non-toxic cancer therapies. And there's, I only have 5 minutes left, so I can't go into all of this. Enhance your immune system. Very important. It's not only good to have an optimal immune system, but an immune system that can recognize the cancer cells. Because cancer cells now know how to shield or cloak themselves from immune recognition. Detoxification starts from the mouth. A negative thought can kill us faster than a bad germ, was once said. So we need to detox our thoughts and our emotions. Nutrition, we know about that. Eliminate pathogens. We know that bacteria, viruses, parasites, fungus, and others are implied in the chronic disease process, and for sure cancer. Oxygenation, we need to have a highly oxygenated environment. Sometimes we take a deep breath and it feels uncomfortable, doesn't it? Because we're shallow breathers. So we need to oxygenate. And then, of course, the emotional, spiritual aspect of health and healing, I believe it's number 1. Maybe that's why I put it in red on the slide. But I seldom see a patient that is 100% cured or in remission from cancer who has not addressed the emotional aspect of disease. If you or someone you know has cancer, first of all, don't panic, get educated. And this is the beauty about Fran's Health Summit, that education is in the forefront. Cancer is not a death sentence. Develop a plan and write your own story. Not the story that you're being told by your physician, but your own story. I suggest that you take out a notebook and write your 3 months, 9 months, a year, 3 years, 5 years plan, because the body will respond to what the brain is telling it. So we need to, in writing, not in your laptop or on your phone, set out your purpose. What is your purpose in life? What are your goals? And write them down. Healing is within you. As physicians, we cannot heal any of you. We could only heal ourselves. So we are vehicles to help you in this journey. And then always have an attitude of victory. So thank you all for having us.